So what we know for a fact is that the studies have shown that the students who spent all or most of their time attending classes online, we lost comprehension, focus, and engagement, and we saw that through learning loss. And we know this from experts. And others found, as we just discussed, that stress, anxiety, and depression increased as well, which also negatively affects learning, with a growing consensus that students are at least 1 or 2 grade levels behind. And that problem becomes more severe the younger the students are. Because as we know, some of the students never got to go to kindergarten or first grade or second grades. Their first experiences were at home and online learning. And we know that, what we also know is that this was the result of policies that we know now had little or no effect on the spread of COVID, according to Johns Hopkins meta-analysis published in January. The analysis concluded that, quote, lockdowns have little to no public health effects. They have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument, end of quote. In other words, these negative effects on education associated with the pandemic, which include learning loss, loss of focus and engagement, increased stress, anxiety, and depression, were exacerbated by our policies that we did during COVID. So there are lots of, we're going to hear a lot of words about learning loss and a lot of words about mental health issues. But where is it? I don't see anything in the budget to address the problems of learning loss. As a matter of fact, you said that the money from the feds was enough money to solve the problem with learning loss. Does that mean that you have a plan to solve the problem with learning loss? And is that money adequate to address the issue? And is there a long-term plan? So I have in front of me the Start Strong assessment, which just came out this weekend. So that's our only report that we have so far. The reports are pretty frightening. I mean, if you look at it, and it's only, it's the major cities. Trenton has an 11.9% of the students meeting the standards, and you have to compare that. We're going to be discussing charter schools. The comparison to charter schools is significant. Why aren't we addressing learning loss more clearly in the budget? And can you tell us what you think the cost would be to address this learning loss? Because in reality, we've lost these kids. Some of these kids are 2 years behind. We cannot catch up those 2 years by saying, okay, you're now going to 4th grade, so the 5th grade teacher is going to have to teach 4th grade and the 5th grade curriculum, or a sophomore teacher is going to teach the sophomore curriculum and the freshman curriculum in order to catch them up. So that's what we need to know, is why don't we have transparency on how we plan to address learning loss?
Thank you. So first, Governor Murphy followed the science and worked to open schools in the 2021-2022 school year. So we began the school year with every school being asked to open. And from the onset of the pandemic, I recall that in following the science that this was an unknown entity. And so the proper precautions were taken to ensure the health and safety of not only our students, but educators. And so throughout the time of the pandemic, we have been extremely responsive in working to address the most pressing needs of children. And we know that many families experienced great hardships as they found themselves in a moment's notice without income. Many lost shelter, and so we wanted to be an agency with a heart and partner with our sister agencies to provide the most pressing needs. While learning is critical, schools know how to do learning very well. And so our role is to support them. And the funding that we receive from the federal government allowed us to target the funds. So the initial round that was first available was the smallest of the 3 tranches. And so therefore we had this competitive grant only for 16 school districts. But as we expanded, we were able to offer $75 million to school districts to advance areas that were highlighted as being in greatest need. For example, STEM. STEM, with the area of science, technology, engineering, and mathematics, was noted as needing most support because students weren't able to have the hands-on experiences that often accompany their instruction in that realm or in that content area. So we allocated 75% of the $75 million toward that end. We also highlighted for the remaining 25% a focus on visual and performing arts, because we know that our students are extremely creative, and we know that learning through the arts helps students as they work to understand the sciences. So I'm very proud of the targeted approach that use research to share with districts how they can best streamline and target those funds with the 90% that they have from the federal government, as well as a portion of their school budgets to, in fact, support learning loss. Now, when we think of learning loss, oftentimes we can pigeonhole it and think about it just in terms of academics, but it really does connect with your social and emotional well-being. If you have experienced the illness or death of a loved one, it is challenging to expect a student to arrive to school the next day and be fully engaged in learning. So with that, we also provided funding for mental health supports. And the mental health supports continued throughout the pandemic, asking school districts to not only look at the full landscape and infuse ways in which students can come into school and transition and be settled, but to also look at maybe having some small groups for students who may have lost a family member. What about suicidal ideation? Unfortunately, we've heard that many students, and we've seen the data, have looked at that option, which our mental health supports, we believe, have staved off even higher numbers. Our educators are exceptional, and I want to say that again. Our educators are exceptional. They not only had to work with students who were suffering losses, they had to work while suffering losses. So when you ask about the funding, I think that the funding that the federal government has provided is adequate to support school districts in enhancing the programmatic needs that they deem most appropriate to help students move forward from this. It's not a New Jersey phenomenon. It's a national and international phenomenon. So as you mentioned, with students in 5th grade having the teachers required to teach 4th grade standards, we don't approach this problem that way. We approach this problem with a solution with Start Strong of highlighting key standards, priority standards we call them, that will allow teachers to make meaningful connections and help students lockstep going forward. It's not about remediation, it's about acceleration. And what damage we would do to children if we say, because you did not learn all of the content in the grade level you were in when the pandemic first occurred, you had to stay there until you learned all of that content. No, we actually work to meet students where they are, to understand that we're always growing and developing, and that we will put in place the strong supports. We also hired a mental health expert at the Department of Education who will help us in identifying best practices in districts across our state, and with the help of our county offices, we also have the county special education specialists and the county education specialists who partner with school districts to understand what's working and what's not, and to share information. So I am very proud, once again, of our educators and of their ability to pivot. They're very nimble. They work with the parents in their community to respond to the needs of their community. And we have a clearinghouse on our website that shows early on in the pandemic how many school districts were responding successfully to the social and emotional, the academic, the fiscal, the operational challenges that seem to arise overnight. So I want to just give context that learning loss, while on paper looks abysmal, it is very sad for us to look at numbers and see that our children have had this effect from a pandemic. But we do see the opportunity there to continue to advance learning in creative ways, which our districts have done well since their inception, to move students forward and help them re-engage in a learning environment.
Well, I have to say that's, it all sounds like good words, but what is the plan? I mean, the plan, so do we have I'll go back to us, Vice Chair Wimberly. Do we have a number? Do we have a number that we put in the budget that addresses learning loss? I mean, to talk in words that kind of are abstract and say yes, and we all agree, we didn't know on March 20th, 2020, what was going to happen. And, you know, my school district, and my children are adults, but my school district said we'll be out of school for 4 weeks. Everyone had to pivot. Everyone pivoted, whether they were in healthcare or in education and in a clerk at a grocery store. We all pivoted. But we also know today, 2 years later, that we have a learning loss. And we need to know, and I think that the Vice Chair would agree, what is that number? Because again, we have the Start Strong assessment.
Yes.
The Start Strong assessment, if you look at these numbers, now it came out this weekend, I'm just seeing them for the first time now. They're 11.9% approaching or meeting standards in the Trenton school districts is abysmal. So how are we, and why do we think that we have enough money in the budget to address this and be very specific? And then also on the mental health issues. You talk about hiring new people and hiring new people, but what is the plan to deal with these youngsters who, as you stated, have suffered greatly?
Yes.
We know, I'm on the task force of child abuse and neglect. We know there was an increased number of attempted suicides and suicides, an increase in depression. We know these facts. And now the number one place where these children go for their support, in many cases, is in the school system. So through the chair and through the vice chair,
Yes.
if we could get a number and a plan
Yes.
of how we're going to, and not just in like words, but a number and a plan of how we're going to address this, because this will and may and should and will have long-term effects on these kids.